This past week, or the first week of class, we really focused on communication skills. As the title of the class says, Group Skills Class, we're really looking at group as an intervention, meaning it's a form of treatment. And that's really what makes OT unique. One of the rare rehab disciplines where we actually can use group intervention, and we specifically learn about how to lead therapeutic groups. Now, psychologists and master's degree social workers and RNs with master's degree in psychiatry will learn how to lead groups. When you think of speech language pathology or physical therapy or general nurses, they haven't learned how to use group as an intervention. And remember, the history of OTs, we really started out with group intervention in a psychiatric setting, but we can use groups in a psychiatric setting and we can use groups in other contexts. Here are just a few benefits of group. Certainly provide social support. You're putting people in with other people. Oftentimes there's some commonality between the people. Either they're having similar issues, similar age groups, but they have something in common. And we all believe that a person needs to be with other people. No man's an island. That participation in social engagement with other people is an important piece. It can help enhance communication, self-expression. Again, when you're in group, you can really focus on those communication. You can have people talk with each other. They can self-disclose. You can give them feedback. They can establish rapport not only with you, but that trusting, cohesive relationship with the other people in the group. And groups really can be non-judgmental acceptance. You're part of a group. You hang out with this group. You join this group because you feel like you can be accepted. People know your strengths, they know your weaknesses, but they accept you. And for some people, they don't have that non-judgmental acceptance anywhere else except in the group that they come to. They can express the unique values of each member. Again, if it's non-judgmental, people can have unique opinions, unique outlooks, and it will be appreciated. It is a way to really work with a group of people in a cost-effective way. For some times it's easier to get a group of people together and talk about common issues. I know in the psych facility I worked with, they would have medication groups. Rather than meeting individually with one person at a time, they would meet in a group and they'd go around the room and they talk about the medications, the side effects, and those type of things. It can promote, having groups can promote interaction skills at all different levels. You can have a group with really, really low level people, and you can have a group with high level people. And we're going to talk about the different types of groups and different activities based on the levels, meaning their cognitive level or their ability to interact. And it's really a great context for problem solving, relationship, and task skills. If you look even at the research on education, you'll be involved in problem based learning scenarios, and that's really groups. It's a group of people working together. And it's the best way to really learn critical thinking skills, to learn metacognitive skills, which means knowing what you know, knowing what you don't know, thinking on your feet. And more and more educational settings, more people are doing more group kind of work. When we look at the future of healthcare, the term is interprofessional education, and really interprofessionals working in teams. And it's a team they find is the best way for different disciplines to work together, understand each other, respect for each other, but it really benefits the patient. So it really is a form of group interprofessional education. When you're in the group and you're the leader of the group, there are different leadership styles that you can take on. First is a directive leadership. This is really you are the director. You're very much in charge. It's very high structured. You make the decisions, you lead the group. This is frequently done with people who are very low level. They have low cognitive level, or they're very young and they need that structure, or it's they're a novice, they're brand new at something, and so you really have to lead them. Think about taking a group of elderly people and putting them in front of a computer and teaching some of them advanced computer skills. You would really have to structure and help them in order to learn. We oftentimes do use directive kind of approach in our groups. When you go in the community, you'll oftentimes use and lead groups for this class. You'll use more of a directive approach. Facilitative approach, this is more of a democracy. You still have control of the group, but you let people give you input. This works really well for like higher level patients, or if I have adolescents, you empower them. If I want to reach a goal and it doesn't matter to me whether we do this activity or that activity, I'll oftentimes ask them which activity they want to do, because it's reaching the same goal, but I'm empowering them, I'm giving them input, they're making some decisions, and they feel that they're a more active member of the group. And so we really can earn the support from the group by allowing them some input. Advisory, this is where you really are a consultant, and we don't do advisory as much as we could. And this is where you have a group that is established and they might need you to consult. So maybe you do have where you work, they're deciding they're going to have some kind of a Bible group, or they're going to talk about stress in a group, and they just want you to sort of help them get it started. And we can certainly advise people on how to lead groups or how to provide these wellness opportunities in group situations, because we do have a pretty broad background in that in the behavioral sciences, again, much more than some of the other rehab professionals. Here, this is this again. Don't memorize this, but this just helps you look at the leadership styles. You can look at the different member characteristics. So, what is their cognitive level? What kind of insight? Insight means how, what level of understanding do they have in their abilities, in their weaknesses. If they're in denial, well, then they don't have much insight, and we don't have an insight pill. So with some of our higher level people, they may not have any insight that their behavior is getting them in trouble, or that they do have a drinking problem. So we look at insight, the group, how long the group has been together, their verbal skills, and their motivation. Then, based on those characteristics, you'll look across to the right and we'll talk about the directive, facilitative, and advisory kind of leadership in what cognitive level fits well for those groups, what kind of level of insight is good. And you can see the advisory level is for really high functioning groups. Directive level is pretty low functioning individuals or characteristics of the members. The second part, it talks about the different kind of activities and the different styles. So you can see that in the directive, it's very structured. You want to get a task done. It tends to be more task focused. Really, the feedback is really from the therapist. And as you move to the right, which is more facilitative and advisory, there's less structure. People are more actively involved. You process becomes much more important than doing the task. So it's much more process focused. That process is really where the therapy occurs, and you can give them to give each other feedback and learn from each other. So it isn't just driven from us. So it can be a really exciting group to lead with higher level patients. Here's a picture of really when you look at a leader focused versus a client centered group. This is where this is a leader centered focused group. So the leader's talking to a member, then coming back to the leader. The leader's talking to another member, it's coming back to the leader. Sometimes it feels like you're pulling teeth because you're talking to one person at a time. And again, those low level functioning groups, you may have that. So you have a really low functioning group and they're working on a craft project. You're probably just talking to them individually. But as progress, you want it to be like this, a group-centered interaction where you're talking to a member, another member's talking to another member, giving them feedback, you're directing another member to talk to another member. So they're not all talking at the same time, but they're talking with each other. And a really healthy group is when the group leader can sort of sit back and just facilitate the discussion. So they're asking each other questions, they're processing the information, they're being open and honest and giving feedback. And that can be a very therapeutic group if the group leader is able to get a group at this point. And hopefully when you participate in groups within the classroom, you'll start to feel that you as a team or you as a group will start asking each other questions and sort of helping the leader lead, because you'll be able to take on that role. When there are a whole bunch of different ways of looking at groups and the different tasks that people take on. This is just, please don't memorize this list, but just understand that there are some different kind of group task roles. So if you have a task to do, usually there's an initiator, someone who contributes, they come up with new ideas, they try new things, and so you may say, boy, there's sort of the initiator versus the information seeker, who you ask for clarification. You want to get the facts first. You're not going to just run off and come up with a new solution like the initiator type person, but you might be an information seeker. An opinion seeker is someone who loves to seek clarifications of other people. Or, excuse me, information seeker is someone who loves to get information. The third one is opinion seekers, where you're going to get opinions from other people. Information giver is where you offer facts, versus an opinion giver is you just love to give your opinion. An elaborator really gives examples, tries to spell out the suggestions, go a little step further if someone is giving an idea. A coordinator tries to clarify relationships amongst the variables, tries to sort of organize. Someone who's an orienter is you look at the goals and you see where you're at. Okay, guys, this is our goal, and we're way getting bogged down on this. So it helps to sort of orient the group on where you need to go to accomplish the task. The evaluator, the critic, is you have some kind of standard, so you let the group know how well it's doing, or it's not good enough, or it's too fast, and you have some kind of idea of where the group should be at or how well the task should be done. An energizer is someone who sort of leads the group into action. They can prompt them to make a decision. They can sort of motivate people to get going. Procedural, this is they do things for the group. Okay, I'll arrange it. Okay, I'll start typing it, or I'll do the PowerPoint. You just sort of procedurally get things going. And then there's a recorder, oftentimes, of somebody who writes down suggestions. So whenever you give a group a task, all these different types of roles can be taken on by the people within the group. And none are necessarily bad or good, but again, that's why we want to give people feedback on the roles that they take on, and could they broaden the spectrum of roles that they take. When you look at individual roles, so if we just look at a person, whether it's working at a task or in general in the group, these are some characteristic or roles that they can take on. And these specific kind of roles that are listed here are the ones that get in the way. They interfere with the functioning of the group. So as a group leader, you oftentimes have to address this. So you have the aggressor, the person who disapproves of other, attacks other, deflates the status of other people by making negative comments. You have the blocker, someone who's resistant, who's just stubborn, very negative all the time. You have the recognition seeker. That person is always self-boasting, look at me, calling attention to themselves, always doing whatever they can to get the focus back on themselves. You might have the self-confessor. This group uses the group as an audience to tell people all their problems or all their feelings, and they're always trying to get airtime, and they just want to confess how bad they are to the group. We might have a playboy. This one is they joke around, they're nonchalant, they lack involvement, they might just sort of be there to have a good time, and it really takes the focus of getting any deeper. It's a pretty shallow type of person. Dominator, this again is they interrupt, they like to give directions, they monopolize, they try to use flattery, but they just dominate everything. It's like they try to take over. Maybe not in a as strong as an aggressor, but they are dominating, so it's similar to an aggressive. Help seeker. This person just is looking for sympathy. They're very dependent. They want the group to sort of take care of them. And then special interest pleader, where they're just really biased about something and they want to let other people know their opinions or the bias that they have. And so oftentimes when you're leading groups, you're working with all these individual kind of personalities, but that's what makes groups so exciting, because you are working with these kind of behaviors and you're helping the person to look at themselves and to change their behavior so that they can be a more efficient and effective group participant, or to work with other people. Because what we want is the group to mirror what happens in society. Someone comes into our group and they're aggressive and they're angry and they don't want to do anything. You can bet when they're in their family discussions, they're acting that way. When they're dealing with their kids, they're like that. When they're at work, they're like that. And that behavior is getting them in trouble. And so that's why we want to work on those behaviors in a group setting. General behavior problems is, you can look at behaviors another way. You can have dominance or passivity. That's one way to look at it. You have people who talk, 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 whether they're self-seeking, whether they're aggressive, they just want to take over the group. Or you have people who are very passive, where they just want to sit there. And you as the group leader have to figure out, how do we get these dominant people to be more receptive to listening and wanting to help other people, and how do you get the passive people to talk more, to know that what they'll say will be accepted, that they're important, just as important as everybody else. And so you really can work on these kind of issues in a group intervention, where if you were one-to-one, you wouldn't see that dominance or that passivity as much. And so a group setting is a great way where you can see this. Normally when someone's dominant, how you deal with that is you might redirect them. You might really give them some structure so they can't take up all the airtime, so other people have to have turns. You could focus specifically on having the person learn assertiveness techniques. If the person continues to dominate and you know the group pretty well, you could ask the people how they feel about this person being so aggressive toward another person. And so there are different ways you can help work on the dominance aspect. For someone who's passive or very quiet, you can direct questions directly at them. You can notice their nonverbals. You can encourage them to talk and really be supportive of any kind of feedback that they say. You want to have an activity where it's easy for them to engage, or maybe they don't stick out, but they can feel pretty good about starting. You can really try to support them and make it a comfortable environment for them. There are a number of attention getting behaviors. This is a common behavior you see. People just want people to notice them and they want people to look at them. So they can be the person who you hear the same stories over and over again. They're always negative. They can't do anything. They're no good at anything. And really what they're wanting is for people to say, oh, no, you're great. You can do it. And you don't want to reinforce that behavior. So you really want to try to avoid giving the person attention by making those negative comments. Maybe just stop and say, tell me one thing you can do. Or group, rather than let's focus on what you can't do, let's focus on what she can do. So again, then giving them the positive reinforcement, the attention for saying positive things about themselves versus the negative. The help rejecting or the complainer. No matter what you encourage them to do, they complain. It won't work because of this. It won't help because of that. So you want to not go down that route. So you might have them come up with ways that will help, or if there is no way to solve it, then how are they going to deal with it? Because again, what happens is they've been having this sort of style of interacting with people, they've been getting reinforced for it, and now we've got to stop that reinforcement, and they need to learn other ways of interacting with people in a more positive way to get people's attention. Narcissistic member, that's somebody who's very entitled. They think they deserve more attention because they're better or have higher skills than the other people in the group. And you have to be really careful of that you don't buy into that you have to help them connect with other people, and you want to give them reinforcement for noticing other people, giving other people feedback, and you want to be careful you protect the other people in the group so that they're not stepping all over the people, so the people feel like they don't want to talk because of this one group member. So as the leader, you are really in charge of the group, but you want to make sure that people leave the group in a better state than when they came. So even if you're giving them pretty tough feedback, that at the end of the group you've pulled them together and they've learned from it, or maybe they've decided to change some behavior, or they just feel real good about what happened in the group the first time they were able to speak up, or another group member said something pretty negative and you protected them, or you said something not only to protect that person but to help the person who's being so negative to learn from it. So it's really exciting to have to be able to work in a group and think on your feet, and because people are so unpredictable. There's some evidence about occupational therapy and specifically in group intervention. USC Well Elderly Study, this is probably the best known. It's a lifestyle design program. This is where they really looked at occupation-based groups and they compared them to general social groups and non-treatment groups. And they really found that the OT groups, where they specifically looked at how we can help people to engage so that it will help them with their occupations of life, that they were, it decreased isolation. They actually learned some new skills in the OT groups. They had more social support. They were able to model behavior, and they felt that they had some self-efficacy in leading groups and being more independent. And that group that had OT and specific intervention type of groups had these outcomes much more positively than people who just attended their own social groups or just went to a non-treatment kind of group. So OT group is specific, and it is different than some of the other groups. The USC study is done years ago, and they recently replicated it and found similar results. So it's pretty exciting. So there is OT literature. There is evidence in the literature that group is effective. We certainly have a long history of group, and certainly it's based in more of the social sciences. When you learn about kinesiology and ortho and working with neuro, it's going to be less social science. But this is what separates us again from some of the rehab professionals is we have that strong base in social science. We believe the behavioral sciences, the understanding of people's thinking and feelings and emotions are a big piece of therapy. Even if you're a hand therapist, you're treating that hand, but that hand is connected to a person. And when we're trying to understand occupations and how to do client-centered occupation-based therapy, we need to really have a good handle on what's going on within the person.